In today's video, we will discuss the complete list of warning signs and symptoms of depression. To understand these signs and symptoms better, it's a good idea to first take a look at the illness itself. Psychology Pancakes presents All Signs and Symptoms of Depression.
What is depression, and why is it common? Depression is a mental disorder that causes a person to feel sad, down, or empty. It affects how a person eats and sleeps, and how they feel about themselves.
It is estimated that as many as 1 in 10 people will experience depression at some point during their lifetime. Depression can be caused by genetics, stressors like financial difficulties, relationship problems, trauma from abuse or bullying, and other factors.
Depression can be treated with therapy, lifestyle changes such as exercise or dieting, and medications. Treatment options depend on the severity of the depression and if there are any co-occurring disorders present.
Beware the warning signs. Depression is a mental illness that can be triggered by external and internal factors. The symptoms of depression can range from feeling sad to having suicidal thoughts. Some people may also experience physical symptoms such as fatigue, weight gain or weight loss, and problems sleeping.
The following are all of the psychological signs of depression. Lacking interest in things that used to bring you joy. If you no longer enjoy your hobbies, passions, and entertainment sources, it becomes tough to make it through the day. A lack of interest in anything is called anhedonia, one of the main symptoms of depression.
Restlessness or irritability. Restlessness is a common experience, and it's often characterized by a sense of restlessness, problems concentrating, or general uneasiness. It may also manifest physically, for example, when you're feeling restless and can't seem to find a comfortable position. Your heart rate is likely to be elevated in these situations, and the autonomic nervous system is firing off extra adrenaline.
When you feel irritated, it means you're feeling angry or frustrated, impatient, and quick to get annoyed about small things. People who are irritable often react with anger to something that wouldn't really bother someone else.
Feelings of sadness or emptiness. This symptom is known as anhedonia, which is a key symptom of depression. The loss of interest it entails can have a huge impact on your relationships with friends, family, and coworkers, and also makes it more difficult to maintain healthy sexual relationships. It can also have consequences when it comes to work or school productivity.
Feeling guilty, worthless, or helpless. If you find yourself feeling worthless, hopeless, and insignificant, you may also feel a sense of guilt or that you are useless and can't improve the situation. You may feel like you have no power to change your situation.
Focusing on the negative aspects of life can be debilitating. Only working on problems, rather than coming up with solutions, can be disempowering. Try to focus on the good things in your day-to-day and celebrate them.
Difficulty concentrating on things longer than several minutes at a time. You will likely find it challenging to work or study if your concentration levels are consistently low. If you can't maintain your focus, it is difficult to think clearly and complete a task.
If you can't concentrate at work or school, it may affect your performance. Some people also find they can't think as well and make mistakes. This could be because of a medical condition such as ADHD or depression.
Difficulty waking up or falling asleep. If you are having difficulty getting up in the morning or going to sleep at night, you may be able to make adjustments in your schedule of exercise, diet, and light exposure. Unhealthy sleep patterns can be a symptom and also cause of many mental health disorders.
Increased or decreased appetite. Your appetite can fluctuate depending on your diet, stress levels, and hormone levels. This can sometimes lead you to eating more or less food than you need.
Having suicidal thoughts or thoughts of harming yourself. People often experience suicidal feelings differently. You might feel like you can't go on living the life you're currently living and want to die. Or you may feel as though life is too difficult and want to abandon it.
It is normal to feel overwhelmed in difficult periods of life, and it is also common to not be aware of the reasons for these feelings. The following is a list of the physical symptoms and signs of depression.
Moving or speaking more slowly than usual. Your speech may be low, with fewer emotions and more monotones. It may also have more pauses, starts, and stops as depression worsens. As it gets worse, your voice may become hoarser and less fluent.
Changes in appetite or weight. Lack of hunger or increased appetite is a symptom of depression. However, this can also be caused by medications, other illnesses, or infections as well. This can be influenced by the timing of eating a well-balanced or not so well-balanced diet. It may also be affected by your activity or stress level, anxiety, or emotions. Menstruation and pregnancy are also factors to consider.
Constipation. Depression is common in people with chronic constipation, and many of those people find it hard to live their lives normally. Evidence from a recent study found that depression can reduce your quality of life by making the symptoms of this condition worse.
Unexplained aches and pains. Depression is known to cause physical symptoms, such as headaches. Chronic pain can also have an impact, such as sleep problems, and in turn lead to depression.
Lack of energy. Fatigue is usually a side effect of one of your habits, most often due to lack of exercise, but also known to be a symptom of depression. If your fatigue doesn't go away after a certain period of time and you suspect other issues are at play, then consider consulting with a medical care provider.
Low sex drive. Causes of low sex drive can stem from relationship problems, stress, anxiety, or depression. Other causes are sexual problems like erectile dysfunction or vaginal dryness. Pregnancy and having a baby also affect your hormone levels and change when you're pregnant. Raising a baby can be stressful and tiring, which can also have a negative impact on your sex drive.
Changes in menstrual cycles. Not only can changes in your monthly cycles be a symptom of depression, but studies have also shown that antidepressants can affect your menstrual cycle, causing an increase in some symptoms like painful, heavy, or irregular periods.
Disturbed sleep. There seems to be an association between depression and sleeping problems. Insomnia has been associated with an increased risk of developing depression. 75% of people with depression are known to have sleep issues.
The social symptoms of depression include the following: avoiding contact with friends and taking part in fewer social activities. Lacking social interaction can have a negative impact on many aspects of your health. Stress, for example, is higher in people who are not well connected socially than in others. In addition, increased inflammation is associated with every system in the body and brain function as well.
Neglecting your hobbies and interests. Anhedonia is a symptom experienced by many people with mood disorders such as depression. It's defined as the reduced ability to derive pleasure from stimuli that you used to find pleasurable in the past.
Having difficulties in your home, work, or family life. Difficulties in the home, work, or amongst your family can be warning signs of depression. However, these problems can also be caused by different personalities clashing and disagreements over ways of doing things. Divorce, jealousy, and verbal arguments are also common causes of these symptoms.
What to do if you think you're depressed? Depression is a common mental illness that affects people of all ages, genders, and backgrounds. Depression is not a sign of weakness or personal failure. If you feel like you're losing hope, it's important to talk to a professional about your feelings and get the support you need.
However, if you think that the way you are feeling may be more serious than just depression, then it is crucial that you seek out professional help with a mental health specialist such as a psychiatrist, psychologist, or therapist.
If you're feeling suicidal or just don't feel like yourself anymore, you should seek out professional help. At a minimum, you should tell a close family member or friend so they can get you the help you need. We found the top 9 depression facts. Find out what they are here in our next video.